introduce yourselves and we'll get started.
Great. Hi, everyone. I'm Madeline. I'm the outreach chair for BMES, which is the Biomedical Engineering Society here at Cornell. I'll let everyone else introduce themselves as well.
I'll start and popcorn it. I'm Maggie or Marguerite. I'm a fourth year student at Cornell, sending it to Ben.
Hello, my name is Ben. I'm a second year PhD student, currently at Cornell. Carlos, super next.
Hello, I'm Carlos Urrea. I'm a first year PhD student at Cornell. Sarah.
I'm Sarah. I'm a first year PhD student at Cornell, and I'll send it to Nathaniel.
Nathaniel, and I'm a fourth year PhD student at Cornell.
I'm Charlotte Bosworth, and I have diabetes.
Anyone else want to introduce themselves?
You all know me. I'm Zach. I'm the coordinator for JAC. Miguelina, are you there? Or Wanda, you want to say something? Or
I'm
right
Wanda.
you know.
I'm Wanda.
Nice to meet you.
Hi there, I'm Miguelina, and I'm close to getting diabetes. I'm a vegetarian, believe it or not, and I find myself eating a lot of beans, which is a lot of carbs. So maybe you can help me out a little bit, even though this might not be a talk about nutrition, but maybe you can help out in some way.
Hopefully be able to give you a little bit of information to talk to your doctor about. So we hope we can help with that.
I'm Wanda, and I am a diabetic.
Nice to meet you. Okay, so if that's okay, we'll go ahead and get started. Can you all see the opening slide here?
Yes.
Great. Okay. So thank you all for joining us. As you heard, we're all PhD students at Cornell in the Biomedical Engineering Department. The goal of this presentation is to arm you with information on diabetes and its treatments so that you can use this information to advocate for yourself at your doctor's office. So we do want to make it clear we are not medical professionals, so we cannot give straight medical advice. We are only here to provide you information so that you can discuss it with your doctor next time you see them.
Great. So first, we should definitely start with some basics about diabetes, although some of you from your own experiences might know a bit already. So to start with, it's a chronic, meaning long-term disease that occurs when the body either doesn't produce the hormone called insulin or it is insensitive to insulin. Either way, this results in an increase of sugar or glucose in the blood, as well as the urine. This increase in blood glucose is a systemic issue. It affects your whole body, but it's known to damage particularly the heart, blood vessels, eyes, kidneys, and nerves. It's a very common disease, especially in the United States, and it's a result of genetics, socioeconomic factors, and environmental factors. And specifically because it is affected by socioeconomic and environmental factors, it's much more common in older populations. That said, I guess a convenient part is that it's pretty easily detected by blood sugar tests. It's a very simple test to conduct in any medical setting.
So I will provide a bit more detail about the two different types of diabetes. So as as Maggie mentioned, there's two types of diabetes, type 1 and type 2. And while both types of diabetes ultimately result in cells not absorbing glucose, they develop differently, and there are different mechanisms present in the two different types. So one important thing to understand first is what insulin is and what glucose is. Glucose is a type of sugar that your cells need to keep your body moving and healthy. It's used all over the body and is one of the most important energy sources for your cells. And so insulin is another special molecule that regulates how much glucose is allowed into the cells. You can think of it as sort of like a key that unlocks the cells to allow glucose in when they need it. And so type 1 diabetes is believed to be an autoimmune disorder. And you can see an image of it on the left here. And what happens with type 1 diabetes is that your body attacks beta cells in the pancreas, which are cells that naturally produce insulin. And so once these cells are gone, your body no longer produces insulin. So there's nothing, telling the cells that they should let the glucose in. This is why, type 1 diabetes can be managed fairly well with insulin injections and proper monitoring, because although your body does not produce glucose, it can still respond normally to the glucose. Your body does not produce insulin, it can still respond normally to insulin if it is injected. Type 2 diabetes, on the other hand, is more commonly developed in adulthood and is less well understood. It's likely a result of a combination of environmental and lifestyle factors, and it occurs when the body no longer properly responds to insulin produced by the pancreas. So even though your body is still naturally producing insulin, it's as though someone changed the lock almost on the cells, and the key or insulin can no longer open them to effectively regulate glucose uptake. And so this, again, leads to an accumulation of glucose in the bloodstream, a lack of glucose in the cells. And the fact that the body does not properly respond to insulin means that insulin injections are not necessarily as common of a treatment for type 2 diabetes. And that's, there are some other treatments that may be more effective.
Yeah, so building off of what we were talking about, so some of the effects the causes for type 2 diabetes are high blood pressure and pancreatic diseases and obesity. These are things that usually they're warning signs that doctors will look for. If they see this type of stuff, then it's more likely, it increases the likelihood of having diabetes. Also, as you increase with age, or if you have a genetic predisposition, if your parents or your family had diabetes, it's more likely that you're going to develop this disease. Also, having pretty high stress environments or being in an environment with high stress can increase your likelihood of developing diabetes. And then that's mostly things that you can change. And then now things that you can change are if you have a sedentary lifestyle, if you don't exercise as often, it increases your likelihood of developing diabetes. Also, eating unhealthy food and having a very unhealthy diet, and we will talk a little bit more about it. What does that mean moving forward? And then some types of medicine can increase your likelihood of developing diabetes. So diabetes is just an increase in blood sugar. So sugar is just stays in your blood and it doesn't go out. So some medicine can affect that process. But as soon as you take off the medicine, and if your doctor knows about it, they can take you off and it will usually go back to normal. But there's different effects that can be changed. Now, what are some signs that you have the disease or that it can be developed? And it's probably something that you realize, and how you first your doctor is kind of looking for and kind of warning signs are frequent urination. You're always thirsty, always hungry. Your wounds don't heal. If you have a wound, it would take longer than normal to heal. There's a sudden weight drop or gain. There's this tingling in your hands or feet, you can start either feeling a lot or stop feeling. You have blurred vision or dizziness, and you're more irritable than normal. Also, other warning signs are a lot of UTIs or yeast infections. and frequent infections for that matter, just more than normal. If you start to see that rate of infection increase, then it's probably because of diabetes. Also, for type 2, when you have this insulin resistance, it's usually to develop a darker patches on the skin. So if you see darker patches in the back of you, these darker patches usually develop in the back of your neck or in your armpits. Those are usually the places where more friction to happen. If it's kind of a warning sign also for insulin. For having a lot of insulin resistance. Also, extreme fatigue, feeling more tired than usual. And for the man, usually develops erectile dysfunction. So if it can be a warning sign of diabetes. So some of the long-term effects of having diabetes, and this is having just high blood sugar, not having treated at all, just water basically what increases. So having high blood sugar basically affects either your microvascular vessels. So these are small blood vessels, places where the part where the blood vessels that pass are really, really small. So like in your eyes, if there's damage to these blood vessels, it may cause retinopathy, cataracts, and glaucoma, just because there's very small vessels going around your eye. So if you have an increase in blood sugar, that can have an effect there. In your kidney, as we were talking about, it's overworking of the kidney just because it has more sugar than usual. It has to filter out more and more blood and try to filter that sugar out. It can overwork the kidney and result in nephropathy. So basically that's it. Your kidney stops working as well. Your nerves with high blood sugar, it results with pain or numbness. So you start that tingling effect or that stop feeling or feeling a lot of pain. That's usually because your the high blood sugar is affecting the normal functioning of the nerve. And going to macrovascular, which are large blood vessels in your brain, there's an increased risk of stroke. In the heart, the high blood pressure increases the risk of coronary heart disease if that's not treated. And in the extremities, since there's a reduced blood flow, if you have any wounds in the feet, and then combined with the lack of this numbness from the nerves, it results in slow healing wounds that usually go untreated. So just make sure to always look for any wounds that you might not feel, but take a closer look at it to avoid any further complications.
Great, now we're gonna go over some common treatments that if you are diagnosed with diabetes, or since some of you have been, your doctor may recommend, or some overall treatment plans as well.
So while type 1 diabetes you're born with and cannot be reversed, type 2 diabetes, it is possible to reverse a diagnosis through healthy diet and exercise. So key parts of a healthy diet that are recommended for someone diagnosed with type 2 diabetes are to include healthy carbohydrates, fiber-rich foods, heart-healthy fish, and good fats. Some of these include lots of fruits, veggies, whole grains, nuts, and beans. Additionally, heart-healthy fish can be a great option, but the heart-healthy is emphasized in that, so fish fries or other fried fish might not be recommended. Also, it's good to avoid saturated fats, trans fats, and high cholesterol and sodium, which is often found in very processed foods that can be purchased at the store. Additionally, to complement a healthy diet, exercise is recommended. And while individuals' exercise needs will vary greatly, a common guideline is 50 minutes of exercise 3 times per week. It's important to incorporate aerobic exercise into this, so that could include walking, cycling, swimming, team sports, Pilates, or yoga to get your heart rate up and your blood pumping. And while this is a guideline and some examples, it is very important to exercise according to your own ability and what is healthy for you.
And now I will talk a little bit about the medications that are used to treat diabetes, specifically type 2. So these medications typically are prescribed after a first round of diet, exercise, and lifestyle changes that help to lower the effects of the diabetes in many cases, and can help the doctor see how badly some of these medications are needed. Metformin is probably the one that some of you are familiar with, as it's usually the first line of treatment given by a doctor, and it directly works by lowering the glucose that's produced by the liver and sent into the bloodstream. However, there are side effects such as nausea, abdominal pain, bloating, and diarrhea. Another type of medication that is the sulfonylureas and gluconides, which are also a pill, but they help to the body to secrete more insulin and increase the sensitivity of insulin in the body. However, this can cause weight gain and low blood sugar over time in individuals. And the last kind of treatment that I will talk about here, as far as these these medications, is an injectable agonist that helps to stimulate insulin release as well as suppress glucagon. And glucagon is basically very synonymous in this case with glucose. So, however, it does cause nausea, vomiting, and risk of pancreatitis. So of course, these are all prescribed with doctor oversight, but just to give you a heads up about how these work in the future. So another therapy, as Ben mentioned, was insulin is sometimes used in conjunction with the previous treatments, lifestyle changes, and there are two different types of insulin you should be aware of: short and long-acting insulin. A long-acting insulin will stay in the bloodstream and requires fewer injections, where a short-term insulin needs to be injected more regularly. However, there's less risk of long-term issues due to lowering blood sugar permanently. Another option is weight loss surgery, and it's usually more of a last resort that can be done to change the digestive system to help deal with the symptoms of diabetes by lowering your body's ability to absorb nutrients. Of course, that comes with various lifelong side effects that can't be altered once the surgery has been completed.
Cool. So clearly there are a lot of options in terms of treatments and managing and all of that. And again, this is a conversation to have with your doctor, but when you're at the doctor and you're getting all this information and being prescribed things, it's really important to know that you are the expert on your body and the way that diabetes is affecting you. The goal is to get you to a lifestyle that is comfortable for you and healthy for you. And again, like a lot of these medications or even insulin are standard treatment, but maybe the standard treatment isn't exactly great for you, which brings us to our first point, where a lot of medication has side effects. If the side effects are affecting you especially hard, or if you have a pre-existing condition such as IBS, or you already have a lot of food allergies, your stomach is already like a little sensitive, you're entirely within your rights as a patient to ask, this one isn't going to work for me. It is going to lead to a lot of stomach aches in the future. Can we please try something else? Also, just because something works for you the first time doesn't mean it is going to stay being the right course of treatment for you. Diabetes and your life is dynamic, things change. Again, like your medication can be as dynamic as your lifestyle is. If you suddenly, I don't know, have grandkids or want to run a 5K because your friend is doing it, and you feel motivated to do so. Again, like once you start on a medication, like you're allowed to change, which a lot of people don't really do, but like please advocate for yourself and like say if this is no longer something that works for you or is no longer meeting your needs. And then the other thing, especially with insulin, but also with other drugs that need to be taken at the same time every day, the logistics of that matter. And if it's a burden to you, either because of like, you know, keeping insulin at the right temperature or getting injections in the same area is actually really difficult for you, those can be taken into consideration. And that should be part of a discussion with the doctor about if a medication or if a treatment plan like actually works out well for you. Again, like you are the center of attention, you are the main event. This is all supposed to be about you and getting you back to a place that is a healthy and happy lifestyle for you.
Great. So really quickly, I want to know, it looks like this meeting might end in like 6 minutes. So maybe I can really quickly go through these slides and then we can regroup for questions afterwards. But I just wanted to really quickly go over some of the current research going on at both Cornell University, the Ithaca campus, as well as Weill Cornell Medicine in New York City, to kind of hopefully further understand, aid our understanding of diabetes, and then hopefully lead to better treatments in the future. So the Alonso Lab at Weill Cornell Medicine in New York City is looking at understanding the biology behind diabetes a little bit better. And they do a lot of research looking at genes that could be influencing diabetes risk. And if you have mutations within those genes, if you could be more likely to develop type 2 diabetes. And that would be due to the genes that those, or the proteins that those genes encode, may be affecting the way that your insulin producing cells are either growing, proliferating, or even reacting to, or your cells are reacting to insulin. They're also looking at how stress affects beta cells, which beta cells are the cells in your pancreas that produce insulin. And some stress is needed in order for insulin to be produced, but if there's too many, you're going to have too much stress. If there's too much stress, you're going to have death of your beta cells at too high of a rate, and decreased performance in insulin production. So they're trying to find this kind of sweet spot in the middle that can be manipulated, hopefully, for treatment of type 2 diabetes. And then there's also the LEAK research group, which is actually located here in Ithaca, but they're partnered with Weill Cornell Medicine, that's doing a social kind of study on how lifestyle interventions may help reverse prediabetes. And so this is a study into how creating a community and providing greater information to certain populations could help prevent diabetes. And this includes group telehealth check-ins and nutrition lessons, as well as cooking lessons, and then group and community-based exercise classes. The MA Lab also is looking at finding better treatments for type 1 diabetes, and one of those includes injectable microgels for insulin delivery, and these gels would basically work similarly to how your beta cells act, where when there's high glucose levels, they change a little bit and release insulin to help lower blood glucose levels, as well as they're looking at different materials that can assist with insulin producing cell transplantation and basically shield them from any kind of immune responses that may lead to transplantation failure. And then finally, the Wong Lab here at the Ithaca campus, in collaboration with the University of Missouri, is working on delivery methods for islet cells and insulin producing cells that will then help with insulin secretion in the body, and hopefully help forward treatments for type 1 diabetes. So that is all the slides we had prepared. It looks like we have about 2 more minutes left on this meeting. So Zach, I don't know what you would suggest, but maybe we log
Well,
off.
I've been working away trying to update the license, but things are not cooperating. So it looks like we're gonna get kicked out of here in 2 minutes. But if you just click back on the same link that got you here in the first place, we can come back and get to some questions that you all might have. So maybe in in this first 2 minutes, does someone have a question that could get us started before we have to reconvene?
Great.
Comment?
Well, I have some question about the medication metformin, because that's what I'm taking. does it have any ill effects other than helping you with control your diabetes, but does it have some effects that are not so desirable?
Yes, it does. And I think we did have some of them, at least the more common ones, were listed on the slide. So if we could go back to that. Yeah, so again, it's more of nausea, bloating, diarrhea, and abdominal pain, which are some of the more common side effects from that.
Yeah, I don't have any of those.
Okay. Those are the most common. There are more rare cases, but typically those are what you would see. And your doctor would, if you were feeling some side effects, you could talk to your doctor, who might also, he could lower or raise the prescription as well, the amount you take.
Mm-hmm. Mm-hmm. Yeah, it was talking about some tingling and so forth in hands and feet. What I have is that it's like my fingers and feet and my nose get very cold. And I don't know if that has anything to do with a diabetes effect or not.
Well, before we start answering that, maybe we got 15 seconds and we'll have to pop back in. So please don't give up on the Q&A quite yet. Let's reconvene in a couple seconds. Hit the same link. See you in a second.